Have you ever walked out of a clinic wondering why you needed so many tests for a simple fever? Have you ever looked at a long medical bill and thought, was all of this really necessary? In our modern healthcare system, tests have become a routine part of almost every visit. From blood tests to scans, from X-rays to MRIs, we have learned to believe that more testing means better care. But is that really true? The truth is, while medical tests are life-saving tools when used wisely, many are ordered more often than needed. This quiet problem of over-testing has grown over the years, costing not only money but also peace of mind, and sometimes even health itself. Imagine a simple scenario. A person goes to the doctor with mild chest pain. Immediately, a long list of tests appears: ECG, echocardiogram, blood test, chest X-ray, maybe even a CT scan. Sometimes these are necessary, but sometimes they are not. The pain could be due to stress, acidity, or muscle strain. Yet out of caution or habit, all tests are ordered. By the time the patient leaves, they are worried, confused, and carrying a bill that could have been avoided. This is the world we live in today, a world where medical tests are overused. To understand how this happens, we need to look at why it happens. One major reason is fear. Doctors are often afraid of missing a diagnosis, of being blamed later for not ordering enough tests. In many places, the culture of defensive medicine has grown stronger. Doctors think it's better to overtest than to undertest. They believe that by doing every possible test, they are protecting themselves and their patients. But in reality, overtesting can do more harm than good. Another reason is patient expectation. Many people believe that a doctor who orders many tests is more thorough and more caring. Some patients even demand tests because they associate technology with trust. They feel reassured when they see reports and numbers. They might think, the doctor is really taking my problem seriously. But this belief, though understandable, can lead to unnecessary procedures. Good medicine isn't about how many tests you take. It's about how accurately your problem is understood. Then there's the influence of money and system pressures. Hospitals and diagnostic centers often depend on tests as a source of income. Machines and equipment cost a lot to maintain, and the more they're used, the more profit they bring. In such systems, doctors may feel pressure, sometimes direct, sometimes subtle, to order more tests. It becomes part of the routine, even when not essential. The result? Patients spend more, insurance costs rise, and healthcare becomes less affordable for everyone. But the problem doesn't stop at money. Over-ordering tests can have physical and emotional consequences too. Every test comes with risks, however small they might seem. For example, frequent CT scans expose patients to unnecessary radiation. False positive results, where a test wrongly suggests a problem, can cause anxiety and lead to further unnecessary testing or even invasive procedures. A harmless variation in a lab result might send a patient into a spiral of worry and additional tests that were never needed. Take the case of thyroid function tests. Many people get their thyroid checked every few months without any real reason. In most cases, unless there are clear symptoms or a known thyroid condition, such frequent testing adds no value. Yet, when the results show slight variations, which are often normal, the doctor might change medication or order more tests. This cycle can continue endlessly, creating stress and confusion instead of relief. Or consider vitamin testing. Tests for vitamin D and B12 are being ordered more than ever before. While deficiencies are common, not everyone needs to be tested regularly. Sometimes lifestyle advice and general supplementation are enough. But because these tests have become popular, they are often added to every health checkup package, whether relevant or not. Annual health packages are another area where over-testing hides behind the label of prevention. Many companies and hospitals promote full-body checkups with long lists of tests, some useful, many not. The idea sounds appealing. Know everything about your body. But the truth is, too many tests can lead to unnecessary worry. Slight variations in results that are still within normal limits can make a healthy person feel sick. Instead of reassurance, these packages often bring doubt. The issue also extends to imaging tests, ultrasounds, CT scans, MRIs. These powerful tools help detect diseases early, but they are sometimes used without solid medical justification. For instance, an MRI for mild back pain might show small disc changes that are actually normal for age. But once they appear on the report, both doctor and patient may start worrying. This leads to more consultations, treatments, and sometimes even surgeries that might not have been needed in the first place. The problem is not that tests exist. The problem is how easily they are ordered and how quickly they replace thoughtful clinical judgment. Once upon a time, doctors relied heavily on patient history, physical examination, and experience. They listened carefully, observed symptoms, and used tests as confirmation tools, not starting points. Today, in a busy healthcare environment, the balance has shifted. The conversation has become shorter, and the test list longer. When doctors rely too much on tests, the art of medicine starts fading. A blood test can measure your sugar level, but it cannot measure your stress. A scan can show your organs, but it cannot show how you feel. Medicine is not just about numbers. It's about people. Tests are tools, not masters. When used wisely, they guide treatment. When used excessively, they distract from it. The overuse of medical tests also places an enormous burden on healthcare systems. Every unnecessary test consumes resources, machines, time, staff, and money that could be better used for patients who truly need them. In low-resource settings, this problem becomes even more serious. When wealthy patients use up testing facilities for minor issues, those with urgent needs may face delays. Over-testing at one end leads to under-testing at the other. It's an unfair trade-off. The emotional side of over-testing is rarely discussed, but deeply felt. When people receive unexpected or unclear results, their minds immediately jump to the worst possibilities. Even a simple borderline value can create sleepless nights. They begin searching online, visiting multiple doctors, and repeating tests. What began as a routine check suddenly becomes a source of fear. This anxiety can affect mental health and quality of life far more than the illness ever would. There's also the matter of false security. Sometimes people believe that if all their tests are normal, they must be perfectly healthy. But good health isn't just about normal reports. It's about balanced living, good habits, and emotional well-being. Over-testing can make us forget that prevention is more about lifestyle than lab results. Exercise, diet, sleep, and stress management are far more powerful than a stack of test reports. Let's not forget the strain on doctors, too. Many medical professionals are aware of this problem but feel trapped by expectations and protocols. They want to trust their judgment, but fear and system pressure hold them back. When patients expect tests, it can be difficult to explain why fewer tests might actually be better. The medical community faces a delicate balance between patient satisfaction, safety, and scientific reasoning. Technology, of course, has its blessings. Modern diagnostic tools have saved countless lives. Early cancer detection, heart disease screening, and prenatal imaging have transformed medicine. But with every advancement comes responsibility. Just because we can test everything doesn't mean we should. The wisdom lies in knowing when to stop. So what can be done? It begins with awareness. Patients should learn to ask questions. Why do I need this test? What will happen if I don't take it? How will this result change my treatment? These are powerful questions that shift the focus from automatic testing to meaningful testing. Doctors, too, can reflect before prescribing. Is this test necessary? Will it really help the patient? Or am I doing it out of habit? The key idea is appropriateness. Tests should be ordered for the right reasons, at the right time, and for the right patient. Medical guidelines already exist to support this, but they need stronger application and communication. Initiatives like Choosing Wisely in several countries encourage both doctors and patients to discuss unnecessary medical procedures openly. When both sides communicate clearly, overtesting can be reduced significantly. Education plays a crucial role as well. Medical students should be trained not only to interpret test results but also to understand when not to order them. A good doctor is one who knows what to do, but a great doctor also knows what not to do. The public, too, needs to change its perception of healthcare. We must learn that more doesn't always mean better. A doctor who listens carefully and orders fewer tests is not careless. He or she may actually be more experienced and confident. It takes courage and knowledge to practice restraint in a world that rewards excess. Over-ordering also affects the trust between doctor and patient. When people realize that some tests were unnecessary, they begin to doubt their doctor's motives. This damages the very foundation of medical care, trust. By promoting transparency and honest communication, this trust can be rebuilt. Patients should feel comfortable discussing their concerns without judgment, and doctors should feel free to explain their reasoning clearly. The media and health industry also play their part. Advertisements that promote complete health checkups or promise total body scans often create unrealistic expectations. They make people feel that unless they are constantly tested, they might be missing something. Such marketing feeds on fear, not facts. Instead of encouraging overtesting, we should promote responsible health awareness. At its heart, medicine is about healing, not overanalyzing. A good doctor uses tests as tools, not crutches. A good patient understands that the goal is wellness, not endless investigation. Together, they can build a more thoughtful, balanced approach to care, one where every test has a purpose and every report tells a story that truly matters. If we continue to ignore this issue, the consequences could be serious. Rising healthcare costs could make treatment unaffordable for many. Patients could become more anxious and less trusting. Doctors could become more mechanical and less human. The healthcare system could become more about numbers and less about people. That's not the future we want. We must return to the basics of good medicine: listening, understanding, reasoning, and then testing when truly necessary. Every test should have a question it aims to answer. If there's no clear question, there should be no test. As technology grows, so should our wisdom. Artificial intelligence, big data, and advanced diagnostics will continue to shape medicine, but they must serve judgment, not replace it. Machines can process information, but only humans can interpret meaning. The challenge ahead is not to limit progress, but to guide it wisely. Imagine a healthcare world where tests are chosen carefully, explained clearly, and used meaningfully. Patients would feel empowered, not overwhelmed. Doctors would feel trusted, not pressured. Hospitals would function efficiently, not wastefully. Such a system is possible if we remember that medicine is an art guided by science, not the other way around. So next time you or someone you love visits a doctor, take a moment to pause, ask, understand, and participate in the decision. Don't let fear drive the process. Let knowledge and trust lead it. The goal is not to avoid tests completely, but to use them wisely, to balance caution with common sense. Because in the end, healthcare should not be about how many tests we take, but how well we care for one another. Good medicine is not about doing more. It's about doing what truly matters. A single thoughtful test, guided by experience and compassion, is worth more than a dozen done without purpose. So let's choose wisely. Let's value wisdom over volume, understanding over overuse, and trust over testing. Because the best diagnosis doesn't always come from a lab report, it often comes from a conversation. And sometimes the most powerful prescription is not another test, but a thoughtful pause.